at all?
No.
Okay, any of your home medicines changed?
Yep.
Let's start. Have you had any nausea or vomiting?
No vomiting, but the Tuesday after I had my last treatment, I had a day of, it feels like you had to roll down the window, get cool air, kind of nausea, but it didn't stop me from doing anything, so.
Did you take your medicine for nausea? Went away. Yeah. Do you have diarrhea? Constipation?
I do usually right after the treatment for a couple days.
Do you have something that you would take for that?
Yep.
Stool softener and Miralax?
Yep. Okay. I've been doing the natural. I've been eating lots of prunes.
Oh, good. And then does that work?
Mm-hmm.
Okay. How are you doing eating?
No, never a problem. An appetite, I can only eat a little bit because I did have bariatric surgery a couple of years ago, but oh yeah.
Very good, very good. Any other problems that I need to know about?
Mm-hmm.
Okay, then I will. Where is your call light? I want you to have that.
Oh, it's probably hanging right here.
Okay, very good, very good. Is there anything that you need before I get going?
Nothing at all.
Do we use the freezing spray on your?
Nope. So I have a new nurse today. Her name's Jim. And today I start the new treatment. This is the Taxol carboplatin. And she's going to print out some instructions and tell me all the side effects and things that I need to be aware of. So I'm going to pause for a second, and I'll be back when she gets ready to put that in and let you know how the last couple weeks went.
Because, of course, I don't know if they give you anything written.
Okay.
I'd rather do this and make sure that you know exactly what's going on.
Okay.
The first drug is called Taxol. That part you knew.
Right.
You're going to come weekly for this.
Right.
And the other name, the generic, is paclitaxel. It's given for many types of cancer.
Okay.
But breast is one of the
top
big
one.
ones,
Okay.
yes. And because I feel that this is way too much information, this is how I do it with patients.
Okay.
I put under side effects important things to remember. Not all of these are listed that are going to happen to you.
Right.
In the medical community, we deem a common side effect a side effect to be greater than 30% of the people getting that drug that occurs in them.
Okay.
So I'm going to go over what I feel are the common ones, and they're all written right here. Occurring in greater than 30% of the patients getting Taxol.
Okay.
Low blood counts, and you know about that.
Mm-hmm.
You need to wash your hands frequently. You need to get your blood drawn when they say.
Yep.
And
once a week.
Also wash your hands frequently. Yep. And then Taxol can cause hair loss. Well, Adriamycin already did that.
Yep.
So just so you know, your hair most probably will not grow back during this regime.
Okay.
Okay. Taxol can cause, this is a medical term for pain in the joints and muscles. It's temporary, occurring about 2 to 3 days after you get this, and then it goes away. You would take Tylenol, or if they have said that you can take Motrin or ibuprofen, you can.
I can't take NSAIDs.
Then don't do that. Okay. Peripheral neuropathy. This is an important thing. This was not one of the side effects of Adriamycin. You did? Oh. This is important because all of the rest of the side effects that I will talk to you about are temporary, reversible. When you're done with this, things come back. Some things take longer than others, but it comes back. Peripheral neuropathy, we never know.
Right.
That is why I will also have to copy a baseline for
Yeah,
how
he
you're
told
handling.
me if I feel numbness more than a specific amount, let him know immediately.
Yep, yep.
Because if it gets to a point, it could be non-reversible.
Exactly.
So, yeah.
Very, very important. And we're not talking about just fingers. It can be toes.
That's
Yep,
that is the
yep.
funniest thing because it's not a side effect of my previous, but I did have it for 2 days.
And now you're okay?
Mm-hmm.
Okay. Nausea and vomiting with this drug is usually mild.
Okay.
Diarrhea can be. Make sure you have Imodium on hand at home in case you need it.
Okay.
I don't see it that often. Mouth sores, I don't see that often. I'm amazed that it's greater than 30% of the people. Hypersensitivity reaction. We have been giving Taxol for years and years and years. And every once in a while, we'll have someone who has a reaction to it. It could be that they get flushed, or they're instantly sick to their stomach, or they could have pain somewhere, like in their back.
Okay.
If you don't feel good in any way, you push that button right away.
Okay.
Now with Taxol, we take your blood pressures every 15 minutes.
Okay.
It does not mean anything is wrong. That is what we normally
Monitor.
do.
Yep.
Yep,
Okay.
yep. So that is, like if you had fever, flushing, chills, trouble breathing, or hives, you'd put that little button on right away.
Okay. And since this is my first time, I'm going to be even more aware and more.
Yes,
Okay.
yes. Generally, I haven't seen Taxol reactions later, like second, third, fourth, fifth infusions. It's generally the first one.
Okay.
That is yours. Carboplatin, I did the exact same thing.
Okay.
Because Grace is not my middle name. And the generic term for carboplatin is paraplatin.
Okay.
It is also a drug that's been around for years, and it's used for many things, but it's been used for breast for a long, long time.
Okay.
Most people do not experience all the side effects listed here. And what I did was I went over the common side effects occurring in greater than 30% of the people receiving carboplatin. Low blood counts. Oh, I'm sorry.
Will I get
I did
the new plastin patch with this too?
no,
Okay.
because the low blood counts are not as significant
Okay, good.
as adriamycin and
And mine
cytarabine.
has actually been pretty good. I've been a good girl.
Then
eating my
if
meat
you-
and all that
then
good
you're
stuff.
doing very good. Nausea and vomiting. You will be medicated with some nausea med here today.
They're not giving me steroids, are they? It's like pumping me full of steroids.
With Taxol, I have to give you Decadron, yes. I
Okay.
have to. Because of the hypersensitivity, I am giving you Decadron 10. It's not a large dose.
Okay. Because I opted out last treatment. I didn't have any steroids.
Yeah, I don't think that you're going to be able to opt out of this one.
Okay.
You want me to call him?
We'll try it on the first one. Because when I did
What
that
happened?
I was up for 5 days.
Okay, I wonder what the dose was on that.
I don't know. But they said it'll, I said, you know what, sleep nausea, I'll take the sleep. Or
This,
the
Decadron
nausea
for this
over not
one
sleeping.
is given for the hypersensitivity
Okay.
reaction.
Okay.
Hair loss, and we talked about that. Your food could taste differently to you on carboplatin. Just make sure that even if your food doesn't taste good and you don't have much of an appetite, that you eat to the best of your ability.
It's like fighting an uphill battle now.
Weakness can be weak, and blood test abnormality. Every once in a while, we'll see someone with a low magnesium level. Dr. Hurtubise will definitely monitor that for you, and if it's in a certain range, he'll tell you to do A, B, or C.
Okay.
That is it.
Okay, good.
Any questions?
None?
Very good. I will see if your thing was faxed down,
Okay.
and I will, as long as you're okay with that, I'm okay.
Yep, I'm good.
Your family, your entire family's in here?
Oh, my dad and my sister.
I'm just going to wash my hands. I won't give you a quick one.
Okay.
in the tube.
Oh, sure.
So how do you feel you've done?
Good.
I'm going to have you hold this.
Okay.
Because once I clean that off, I don't want anything
To rub.
on my cleaner.
Yep. Yeah, the one more time. This is, my daughter and I had the same tattoo. It's for cheerleading. We coach cheerleaders.
You do?
And we always tell them, one more time. Let's do it again. One more time.
Well, you are the very first one that I have seen one more time on.
See?
But you are right. The only way that you get things is over
Keep trying.
and
You
over
don't give up. That's right.
and over again. And that's how it goes.
That's the only way to achieve. You know?
Well, I was a cheerleader, but I don't think I was that
Were you?
great of a cheerleader.
Isn't that great?
It was fun. I had braces, and and you know you should be verbal and not quiet, and so on. I would yell all my rubber bands.
Aw.
That was a long time ago.
I wasn't a cheerleader. I ended up coaching because of my daughter. Yep.
I don't have any daughters. I have all sons.
I got 2 sons.
This particular chair is not an easy use, because if something's on this side, there's no place.
Ah.
Where's your daughter?
Right now, probably at work, I think.
So how old is she?
Oh, she's 22 and going to SVSU to finishing her bachelor's in nursing. Yes, next May she should be finished. Her dream is NIC unit.
Oh my.
Yep.
Well, it's rare that people know exactly what they want to do. And that is such a blessing. I'm in your face.
Yep.
And I'm hanging on to you tight. I want you to take a big breath for me. Big, 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 big. Push it.
Yep.
Sorry.
That's okay.
Great blood return, great port. Just don't move your hands because I have to put a dressing on it.
Yeah, I know. Cover that little sucker up.
Yep, thank you.
Are you dry? Okay. Don't go honey. Is this okay? It's okay. It's okay. It's okay. It's time to access.
So this is, your father is in California.
San Diego.
And this must be frightening for him.
Yes, but I Facebook message when we go to see the doctor. He's there with me. We do video messaging so he can be part of the appointment, and then I video do this, and yeah, a little anxious.
It's hard on family too. It's hard on you. It's hard on.
Yeah.
Just a second. And you can let go.
All right.
Just want to make sure there's no kinks. Thank you.
And we're off, huh?
What?
And we're off?
Well, we are. It's
We'll start?
It's
Yep.
thinking.
And then we'll see you when it beeps and we do on to the next, huh?
I already have the Zofran and the Decadron. As soon as this gets going,
Okay.
I will also start that up.
Okay.
Clean up my mess.
So there starts treatment number 5, guys. And this is the Taxol and carboplatin. We do this once a week for 12 treatments. And we'll end probably the middle of August. And then since last treatment, we had previously taken like a 3-week break, and then I did my treatment, and then it's now 2 weeks later. After I had my last treatment, I was good on Wednesday after treatment, good on Thursday after treatment, Friday I slept, Saturday I slept, Sunday I slept, Monday I was okay, and then Tuesday, nausea. One sec.
Tell me your date of birth, please.
12/14/66.
Thank you. This is an anti-nausea medicine
Okay.
and the steroid, and it goes in over approximately 10 minutes.
Okay. So, and then that Tuesday, I had some nausea, nothing unbearable. Fresh breath made me, fresh cool air made it go away, so that was good. Then I started feeling much better on Wednesday. And then Thursday, my girlfriend Ann from San Diego came in. And we just got to giggle and laugh and spend time together. And she went home yesterday. Bummer. She's just here for the weekend. And so now we're starting this. So the last of the aggressive stuff. And I'm still doing okay, feeling okay. Hoping that this new stuff doesn't have as push as much fatigue on me as the previous, but we'll see. Considering I'm doing it every week, I would hate to have a week of recovery after every treatment. So praying and keeping that up. Side effects are, kind of the same, but not as aggressive. Summer's coming. Well, summer's here. And got some more family coming out in June. So things are going okay. And doing okay. So I guess we'll have more frequent visits now that we're going weekly. And so I guess until then, I'm signing off. Talk to you next week. Bye.